My background is that I'm a human chiropractor. I've been in practice since 1987, and I've been certified by the American Veterinary Chiropractic Association since 1992. And as most of us, we can say that our horses are our mentors, and our horses have been able to lead us down our journey through our lives. And back in 1996 and 1997, we had pretty harsh winters here, and my horses were iced in. I was going over every day and grooming them, but being in a 10 by 10 stall, no place to hand walk, I wanted to go ahead and add a little bit more to the normal grooming technique. So I took from human therapeutics, and we use a cross fiber or also a transverse friction to go ahead and help with adhesions and scar tissue. So I started to apply those techniques to the grooming of my horses. And I was teaching it for the past 15 years to my clients and to friends. And a few years ago, I wanted to go ahead and share it with the masses. So I decided to come up with my own groomer, an implement to complement my technique. So I came up with the Posture Prep Cross Fiber Groomer. Now you can use your hand, you can use a towel, you can use any implement you want, but when you use the technique, that's where it really comes into play, that it's much more therapeutic, it's rehabilitative, it's a pre-ride warm-up, it's a pre-ride evaluation. So if you have a horse that's laid up, if you're at a show and your horse isn't showing that day, or they are, but they're standing in the whole day, it's something you can do before, it's something you can do after. If a horse is really uncomfortable, well, after you've ridden them, you can actually use the massage and get a little bit deeper. So you can use it at really any point in time. So today we're going to talk about the difference between posture and conformation. We're going to define what good posture is, and then we're going to go over how to observe and palpate for some of these myofascial restrictions that we need to understand are big red flags. And another big concept is that our horse's skin and our skin is the largest organ in the body. So that's a precious thing. We can't usually touch and palpate and work with an organ, but we can with our skin. So it's a pretty exciting concept. And then we're going to go through and show how you can actually use the cross fiber grooming technique on a daily basis to really help your horse's posture, help your horse's well-being and performance. So we need to talk about the myofascial system. Let's make it simple. Myo means muscle. Muscle is a contractile tissue. Fascia is a connective tissue. It's not nearly as contractile. There's not a lot of elasticity to it. When we're eating the steak, we're eating the muscle fibers. That's pretty delicate tissue. You can tear that apart. What we call the gristle around the outside is actually the fascia. The fascia actually envelops the muscle and helps to contain it and shape it. And so at the ends, they twist around, and that's where our tendons are. So then the fascia becomes thicker into the tendons. Some tendons are shorter and attached to bones. Other tendons are longer, like our Achilles tendons longer. But you can think of the fascia shaping and enveloping the muscle like the balloon does. So conformation, I'm trying to make some things black and white. I like to define conformation as the structure of the horse's bony structure. We're not going to change conformation. Conformation is something we breed for relative to a discipline that we want to have the horses to be able to perform better at, whether it's dressage, whether it's racing, whether it's jumping. We can't change the length of a cannon bone. We can't change the length of a pastern. So that's where our conformation is fixed. Unfortunately, too often, we've confused poor posture with poor conformation. And that's where you really want to start to look and break down, and it's very empowering when you can see a horse that has poor posture but good conformation, because you know you can help that horse. So posture can be a matter of the arrangement of our body parts, the alignment of our body parts. It can be an attitude. You can say, read somebody's body language by their posture, and that's what I say, that a horse's posture is the language of the horse. And if we think about how we read people, we can start to learn to read our horses that way, especially when we can separate the difference between posture and conformation. The conformation is fixed, the posture changes because of the myofascial system. And you can get your eyes and your hands on your horse's myofascial system and make tremendous changes for them. So this is a pony on the left, and it's the same pony on the right. Now, it's the difference between the poor posture and the pony's conformation that he has and his posture where it's improved. He's had better training, he has better fitness, his feet are in better shape. When you can understand that you can take, I saw this horse come in, I was taking pictures at the same time that the vet was doing the pre-purchase pictures, because I was like, this is going to be a great sample. I knew who the trainers were, I knew what they could do, and so I had a great sample of this pony who was at one point a 4th level dressage pony, is now a competitive driving pony. So that's what you want to see, the profound difference. And it can be even the fact that they were laid off for the winter, even though a layup for the winter I don't think is appropriate. Professional athletes, competitive athletes, amateur athletes, we don't lay ourselves up for the winter. That's a big difference between what is poor posture and what the conformation actually is underneath. So good posture, right? We've all been told to watch our posture. Horses, dogs, and cats, they're quadrupeds. They're on all fours. We're bipeds, but we're animals too. And the big thing that we all have in common is that we need to work efficiently in gravity. We wouldn't be sitting in this beautiful building if it wasn't structured so it was efficient in gravity. It wouldn't stand the test of time, and it will. So we need to look at ourselves and understand that we can control our health and our well-being and our longevity through our posture, through our horse's posture. Our structure can sit, right, on the vertical, my ears over my shoulders, shoulders over my hips, hips over my feet. I'm using postural muscles, but I'm not using other ones. If I put my head forward, I'm putting stress and strain on muscles that weren't made to work overtime. So by having good posture, we reduce the stress and strain to the soft tissues, the muscles and the tendons and the ligaments, and we decrease the wear and tear on the joints. Thereby, we can improve performance, we can decrease incidence of injury, and we also can have better health and well-being and longevity. Because when we're slouching, we're actually compressing our organs. We were talking today about having the organ systems be healthy and the fluids flowing. This is literally the physiology of the circulation of our lymphatics. So good posture for our horses or for ourselves is a really important thing to do. But luckily the quadrupeds have it a little bit easier. So where do we start to define good posture? This is black and white. This is an important thing I want you to go home and start to look at, go downstairs and look at. Good posture has to start with a horse standing 4 square. And that's just not 4 feet, each foot in a corner. Again, it goes back to physics. The cannon bones were made to be on the vertical. Therefore, there's less stress and strain to the soft tissues, and there's less wear and tear to the joints. So a horse that's pretty happy and feeling good, you walk him up and he stops and he stands, generally should stand 4 square. They're on the cross ties, they should stand 4 square. That's what I want you to see. If they're not standing, especially you see those front legs need to be on the vertical, if they're not, it's not good posture. And that's the foundation for good posture. You can have a horse standing 4 square and their posture above isn't optimum, but at least you have a good foundation to start with, right? So we'll look at the subtleties of a horse standing 4 square. If we didn't have Belle up on the right there, you'd say, well, that's not too bad. The hind end's a little bit out on the left, but she doesn't look bad. But when you look closely on the left side, you can see where her front legs, her cannon bones, are a little bit underneath of her. And it's a pretty enough picture. It's a little bit coming out of, that's in the fall. But when you look to the right, she's standing more solid on her front legs, right? And that's the big difference. You can't accept to the left, especially if your horse has been standing like that on the right. and then starts to stand like that on the left, that's a red flag. So that's why I say go home. Look at horses stopping at X. Are they four square? Or look at your friend's horses standing on the cross ties. Look at horses being shown at Devon. How are they actually standing? And you'll start to see where the stress and strain's there when they're not standing with their cannons on the vertical. You can understand about the suspensories and the superficial and the deep flexor tendons have stress and strain that we don't want on there when they're not standing four square. So back to the concept of posture. So we want to look at our horses from the right side. We all have a good profile and we might have a bad profile. The horses are the same way. So the things that we want to look for that we define as poor posture, not poor conformation, things like horse being thick through the throat latch, having mutton withers, straight through the shoulder, the angle of the pelvis. So I'll let you have a look at this picture. This is poor posture. It's not poor conformation. Yeah, he's changed. He went from here to here. He's straightened up. And what happens if you, I don't know if you can see here, that on his chest, there's some scar tissue up on his left chest and shoulder. And when you palpate, I say it's a myofascial, it's a disruption, right? We're looking for disruptions. And that when I palpated that scar tissue into his chest, it actually went down into his sternum. So the chest muscle rotates the limbs in and adducts them. So what happened, this scar tissue actually was rotating his left fore in. His body compensated by turning his right fore out. So he was having a lot of difficulty jumping, and he was having a lot of difficulty galloping. So when we released the scar tissue and the owner followed through with doing the posture prep technique, a month later, he's standing much straighter, and he was galloping and jumping much better. Much, much better. So, and that turning of his feet, it was turning the whole limb through the knee, through the elbow, through the shoulder, up through the shoulder blade to the spine. If you do that, you're affecting everything between. So it's pretty profound, but again, that's a postural thing. That's not a conformational thing. He could be toed in like this, and quite often it's a matter of posture and not conformation, because the shoulder blades aren't attached by any fixed joint. It's soft tissue. It's the myofascial system that you can help to improve. This is a picture of it closer, and what I like to say, this is our inaugural red flag, right? These are red flags, the dents and the dings, that we're so used to ignoring that I'll see clients and I'll go, well, how long have they had that dent? And they go, I don't know. You don't even recognize it because we've never been taught about it. If anything, they say it's cosmetic, don't worry about it.
For sure. How long did they work on that before he started?
Oh, he started to stand more square that day.
Really?
Yeah, because I used some laser, and then I got in there pretty deep, and then they followed through. But it doesn't take much. The body wants to be right. We want homeostasis. So this is a picture of another horse's posture. You see the pretty gray mare on the left. Her throat latch is open. The length of her crest is nice to her withers. Her whole outline looks pretty nice. But when we go to the right side, actually a minute later, it doesn't look like the same horse. She has a disruption in the front of her neck, as they call the prophet's thumb, that they were born with, and that's causing a constriction to her neck, which actually is distorting her posture. So that's the good side on the left and the less than pretty profile on the right side. So you can see how that would affect the horses cantering to the left or cantering to the right. They're actual jumping. The stress and strain that comes down onto the front limb because of that extra compression through here. So essentially, instead of her standing like this, she's standing like this. So she doesn't have the same shock absorbing here, so other parts of the body have to do the shock absorption, which easily could be the tendons and the ligaments in the right fore. So then we look at the same mare. This is her wither height. And where she had a pretty profile on the left side, her posture looked good on the left, she has 3 fingers of a height above the cap of her scapula. On the right side, she has just about 2 fingers. So not to be surprised when you go home and you look at your horse from the right side to the left side, and if you can, just use even the camera on your phone and take some pictures, because you'll probably see some profound differences. And then you can relate that to what you're having problems with your performance, or chronic injuries or stiffness, or in your lessons, or something that's even happening to your body when you're riding them. So we talked about the myofascial system, right? This is a little warning for you because I have a couple of really cool slides of fascia. A little abstract. This is a picture of a horse's rib cage, their torso, where they took the skin off. And they were talking earlier about how pretty the joint surfaces look. You can see the pretty glistening effect of the fascia right over top the muscles. And that's because that actually has some glucosamine and other elements in it so that it can glide. It should be fluid. The skin is the largest organ. The skin is our horse's clothes. Our skin is our clothes. So you can see that pretty texture is a bit thicker. Again, if you think about the gristle around the steak, that's not quite as thick because you don't need that kind of thickness at that level on the horse's body. So we go a little bit deeper. And then you can see, I should say, to the left is the shoulder. And then you can see those angles. That's actually the rib cage. And you can see where the different lines of the fascia down along the abdomen here go with the lines of the stress of the muscle fibers. So the fascial lines are the same as the muscle lines. It's just that the muscles are contractile and the fascia is not nearly as contractile. That's why we really need to have a good warm-up because, right, that fascia that's covering that muscle, that's thinner, but then it twists around and turns into the tendons. So we have to make sure that the tendons get nice and warm. They're not that close to the muscle to warm up. So that's where it is. It's the opposite end of the fascia where it gets thick to the tendons. Nice, thorough warm-up. This is the hind leg. This is the gaskin. So I wanted to just show this because we like a nice, sexy, big form and a nice, big gaskin. That actually tells us that the horse is articulating well through those joints. But we have longer muscle bellies through there, and you can see there's some in the back, and those actually have to glide next to each other as well. So when we're doing the cross fiber, we're affecting the fibers of individual muscles, but we're also affecting the muscles that are next to each other so that they can go ahead and glide. And that's very important in our hocks and our stifles and our gaskins. So the horse's skin is their clothes. We were talking downstairs that if you have a tight pair of leather gloves and you put them on, you're not going to want to close your hands because that's going to put compression on the joints. The skin is the largest organ. There are lots of nerve endings in all of our tissues, and especially in the skin, on the outside of the skin, on the inside of the skin. So the body is going to go to the path of least resistance. If you were sitting here in a fitted suit, you wouldn't be reaching up and stretching and moving around because your body would tell you it's not going to be comfortable to do that. So if your skin's tight, if your horse's skin is tight, the body's not going to want to move naturally into that. So everything that you're doing under saddle, trying to get them warmed up and get their hocks moving when they go out and they're in the pasture or they're standing in their stall, they're going to go to the path of least resistance, which is not going to be sitting nice and quietly into their good conformation, that our warm bloods have a more proportional femur and tibia so that they're standing in the stall like this. Versus if they're tight, they're going to be standing like this. And you're just going to be working and working and working to try and get it like that. So we want the good posture to be all the time. And that's what it's about. So there's less resistance for us to have to work through. Again, so we talk about the red flags. So he's actually eating grass. And as he's eating grass, pulling the grass, his body's undulating all the way down through his hocks and his stifles, and you can even see where he's moving in his hind feet as he's pulling the grass. So that's the body just gently moving as it's breathing, as they're walking, as they're moving. You see that all those joints are moving because the joints get their nutrition through range of motion. If we have a full range of motion, all those supplements that we're giving them, the herbs that we're giving them, the exercise we're doing for them is going to have a better positive effect because the joint is actually improving their nutrition. So as he's grazing and his body's moving, you can see that that's nice and free and supple because the myofascial system's in pretty good shape and his posture's pretty good. But that's what you want to look at in your own horse. And the other big thing that you want to look at is when your horse is standing and then he puts his head down to graze, his back should come up. If his back doesn't come up, his back's tight. There's a problem there. So they're little tests to look at and enjoy and go, well, you know, before I rode him, he wasn't as loose and free, and he put his head down and his back came up some, but now it's come up even more since he's warmed up when I rode him. Then you can actually just say that was a really good ride. Or if it doesn't come up as well, then you go, well, what wasn't so good about that ride and what do I need to do? So little things as you're observing your horse and looking at their posture, because you can look at a video and freeze frame that video, and that is a moment of posture in that point in time. So you want to break that down and think of it, that posture is rather dynamic. I look at good posture being the same as good biomechanics. So here's an evaluation form that you all should have at this point in time. So you want to evaluate relative to the horse's posture. Are they tight through the throat latch? Are they short-necked? Are they mutton withered? If you're not sure what mutton withered is, this horse has a bit of a mutton wither. It's not well defined, but the muscles are quite nice here, and later what we'll have you do is actually before you go home and see your horse, I want you to think about where you might see these red flags. I have to do my red flag thing. The red flags are the dents and the dings and the white hairs and the scar tissue, the loss of hair, because if a horse had some sort of old injury and the hair didn't grow back, that was a pretty substantial trauma. So we're looking to go deeper and find out what happened with those traumas. The bubbles, the nodules, any skin disruption.
Oh, I don't want to interrupt you on that one either, but when you said the white hairs.
That can be a sign of some inflammation going on. White hairs from poor saddle fit, white hairs from where they had some sort of blanket rubs. So it was asking about what bubbles were. Bubbles are great. So I'm going to go through some pictures. So this is a tight, hollow back. So often people will say that my horse's back is fat. That is not fat. That is a tight back. That's a red flag. It's a short, tight back. Again, we have to look at some breeds. Certain conformations have the tendency to have a tighter back. You look at your Andalusians, you look at your Friesians, you look at your Arabs. They're short, strong-backed, broad-backed. They've got this big neck that they have naturally higher head posture, head carriage. So if you have that, you need to regulate it. And so the test is when they put their head down, does that crease go away? If that crease goes away and their back comes up, then you know you're helping to keep the balance of their posture, wanting to have that tighter, stronger back, you know, because of their breed or their actual conformation. But that is a huge red flag. Now in this mare, you'll see the next picture, when I got her back to come up, that's a scar, that's a loss of hair, that was just behind her withers. So something hit her hard enough to do enough trauma to the skin that the hair didn't grow back, and she probably compensated from that point in time and had that really tight back. Some of the big horses, and even if they're not that big, sometimes you really do need to just get up and make sure and evaluate your horse to make sure that they don't have any areas of loss of hair or scar tissue on their back. It's well worth it. And what will happen too, as a horse relaxes, you might not think that they have any hair loss. As their skin relaxes, their pore opens up and stretches out, and you'll see more white hairs, you'll see other other dents and dings come out because everything's relaxing. That scar tissue is still retracted, so it'll be even more profound when you add to the evaluation form. So this is the famous prophet's thumb that they say that they're born with. That I've heard the story that the horse was in utero like this. Well, I really think if they were in utero like this, they'd have some other limb deformity, wouldn't you think? So I'm thinking maybe it's a birth trauma that when they come through the canal, they have some sort of trauma at that point in time, and we're really not going to see it. So, but we think of that, that's the prophet's thumb, it's a sign of a good horse or whatever. That's intra-utero trauma that you want to take care of, because these horses will start to develop in their life crooked because of the trauma and the scarring and the restrictions that are happening to the cervical spine and the shoulder. So another dent, right? Horses, the point of the shoulders and the point of their buttocks. When they're out playing, they're forever kicking at each other, running backwards into a fence, trying to get away from a horse, whatever. The dents and dings are red flags. They're red flags. You need to look for them. What you also want to realize is that you can change them significantly. And there's a profound concept of understanding when you have a trauma like that, because the dent actually resulted from stagnation, from a hematoma. Like you said, when we have a hematoma, we bruise. We don't see it in the horses because of their coat. But that's a swelling. It's a congestion of the blood. And then as the body heals, it retracts, and it quite often causes a hematoma, the scar tissue, and it's an atrophy. It's an area of muscle atrophy and scar tissue. And that's what you want to understand. This is a significantly horrible picture of a horse's back that there's the white hairs, and you see the loss of the hair on his back. That's horrific. What happened to that horse, what his history was when he got that, I don't know. But we're all guilty of it. I know I am. My horse has a little bite, a little nick on his back, and I'm grooming him. I'm like, no, look, he's not sore. He's fine. I can ride him. Well, he might actually be not sore when you touch it, but deep down, the body might be compensating. So just understand, we have to, watch that Jekyll and Hyde thing, so that little trauma, what we think is little, might be significant. So you want to monitor it so that they don't have compensations. So again, just small disruptions. You look at this is the same thoroughbred on the left side. Unless I tell you, you're not going to say that little irregularity in his shoulder is a red flag, but it is. Whether it's just tension there because something else going on, we really don't want to. We want to see nice, smooth, round muscles. When a bodybuilder's fit and they're not posing down, they're like the Pillsbury Doughboy. Especially if we have dressage horses, we want a little flesh on them. They should look nice and soft and feel nice and soft when they're relaxed, and we've got them warmed up a bit. The picture on the left, there's some sort of hole. It's a quarter horse. He's got that on the other side. Where that came from, I don't know if that was actually an injury, just the fact that the way his elbow ties together, the myofascial restriction developed, but we were able to start to release that. This is my horse who had sinus surgery. On the right side, you can see his staples in his face. That was 2010. June of 2012 was the last point in time that I can remember working on the skin up here, where we had to pull out some bone chips that didn't cause a reflex release of his sinus. So he would kind of snot out. So since June, I haven't had that reaction. Again, the skin is our largest organ. There's all kinds of sensory reflexes in the skin that, you'll have a massage therapist work on your sinuses, and your sinuses open up. So 2 years later, I'm working on the scar there because it's just taking that long to heal and things change. So you want to keep an eye on them. This horse had some sort of major trauma to the ribs. It looks like he actually had his ribs fractured. And then people were wondering why this horse was so horribly miserable. But they think, they look past it. We really do. You laugh, but you'd be surprised how often you look past scar tissue that literally has stitch marks in it and go, oh, it's healed. It's a big red flag. It's a big red flag to go ahead and get your eyes and your hands on it and feel it and see what they have to say. And for yourself, if you've had surgery, if that scar's not white, it's pink 30 years later, it's not healed. You know, move it around. Make sure that you don't have restrictions with your scars as well. So bubbles. To the left, you'll see just a very faint bubble. That's actually where there's a dent, but instead of the skin staying stuck to the fascia or with the fascia below, it's puffed out. So that's what the bubbles are. To the right, the bottom one's a bubble. That was a horse that was ravaged as a foal, and so we were working with the scarred tissue on his hind end. The one's retracted, and the other one's a bubble. This is a scar on a horse that I worked on. He was in the country for 7 years, really testy Irish sport horse. And as I released the scar tissue, you can see where it's kind of red and raw because it actually stretched and opened up. His skin went, oh, I can move better. And he immediately relaxed. Everything changed. But not to be too worried if you see that. You always have to work within your horse's tolerance and your safety. Always. Good horse handling techniques. Very testy horse. You had to be careful around him. The owner was the only one who knew how to handle him for herself or for the farrier or for the vet or the dentist because his body, he was tight as a drum. So his nervous system was on fight or flight, right? It's all about the doe out in the field has its tail up and its head up. That's fight or flight. Their tail's down, their head's down. They're relaxed. The same thing with our horses. So no, you could just see posturally. They lick and chew, they yawn, they put their head down, they'll stand four square, and the whole contour of the body, the angle of the pelvis will change. But I wasn't surprised by that. That's pretty exciting. So this is a bubble, and that's my finger in the bubble. Now, when I felt that bubble, it was kind of elongated like this and had scar tissue there. And then as I released it, it changed shapes. And then this mare's pelvis leveled out immediately, like that. This is a picture of a horse that they didn't know why he was having problems. The owner does not know where those scars came from. This is a winter coat on this horse. And you can see the scar tissue, and when you felt deeper in it, and that's right where the back of the saddle is. And there's my poodle. That's Patrick. And it's a year ago in May that he had a mast cell tumor removed. He's 18 pounds. He's only about 16 inches tall. He's a miniature poodle, and he had to have 18 staples from the point of his shoulder around to the other side of his spine. I can tell you, I used my laser on him, and on the second day, I was taking the skin around that scar and moving it because I didn't want any deep restrictions to happen because the skin's an organ. Beneath that is the lymphatic system. Between our skin and the muscle and the fascia below is the lymphatics. So I wanted to make sure that was going to start to heal optimally. So this is a set of not pretty withers. We want to have a nice contour to our withers. We don't want flat spots on the withers. We don't want mutton withers. We want nice high withers. This horse is different from the right side to the left side. This is when she was doing great. This is one of the worst set of withers I'd ever seen. She was a zigzag. She wasn't just a V. Yeah. She was like that. And they've been treating her for years for stifle problems. Wow. And I go, hello. That's why, to use this assessment is not just it can be for the casual horse owner to the professional, that you really want to go ahead and look at the myofascial system, the disruption in the skin, and look at the posture, because if we had looked at the posture, we would say, well, she's not well through her shoulders, and she's not well through her withers, maybe she's overusing her stifles. This scar to the left was completely around this mare's leg. I have no idea where it came from. But she's a rescue, and she's doing beautifully, so I want to do a whole program on her because they have pictures of her when she came in, and her withers were raw, and how she's changing posturally. And so that's what some of these pictures are the part of a program of looking at a horse. So this is a picture of a little Lipizzaner gelding. He had been a stallion, and you can see where the dent in the front of that shoulder is, which these are profound. We don't like dents and dings anywhere. But in the front of the shoulder, it's very profound because it goes into the brachiocephalicus and the sternocephalicus muscle. And that muscle goes from the back of the jaw, the group of them, generally speaking. The back of the jaw across every single cervical vertebra into the shoulder, because it helps to rotate the shoulder forward, lift the shoulder and flex it, and then affects the elbow, affects up into the shoulder blade and back to the withers. So I've seen horses and I go, why do they have a flat spot? And this is all a progression. It's just so much more recently, in the past 3 years, I'm looking at the myofascial system, looking at the skin. It's going to affect the whole thing. And then I realized, you know, the saddle wasn't too far forward. The saddle wasn't the issue with the flat wither. It was because the myofascial restrictions that it ended up pulling and putting tension on the shoulder muscles and the trapezius and made the flat spot. So he took care of the point of the shoulder and the wither popped up. So it's very empowering. I say I'm an artist and I work in living medium, the same thing that you can do for your horses. So this is the horse coming up the line, and you can actually see where, you know, the contour changes, and we had worked on that, but that's a pretty profound looking dent there, and then you can see as his limb comes forward, he's got a little dent in the other side of his chest. This is down in Wellington. You see this dent going around. I took a bunch of pictures. This is a newer horse that I'd done, and I just want to show here, because you see that neck. It's not a very pretty neck. But whenever you're looking at a dent or a ding, again, we're working within gravity. So you want to look and see what other tissue is affected on that line of gravity, where that scar tissue is, where the dent is, where the bubble is. What else is affected? Because once you release that, you might have to go up to the crest to release an area in the crest so the neck can actually come up better. You might have to go below that to release some of the fascia at the bottom of the cervical vertebra, so then that the vertebra can move better. So it's all about the gravity line. That's another picture of him. After we worked on him a little bit, you can see he's kind of flexed up and looks a lot nicer. He was able to turn his head, you know. This is the same horse. That's a bit of a trauma to his rib cage. What happened there? Was he gored? Yes. Here's another right-sided wither, left-sided wither. On the right side, you see the flat spot, and it's kind of popped up higher. On the left side, I have to pull the mane away, and oh, look, there's white hair. That could be part of it. That could be residual because of ill-fitting blankets because of the shoulder and the contour and the posture of the horse. There's the white hairs again. Oh, it's like, you know, you have that, like, little tag in the back of your neck, and the whole day you're going like this. You know? You pull your hair back. I'm just starting to put my hair back in a ponytail, and you get that couple little hairs that are just making you have a headache. It'll make me have a headache. So you just release some of that stuff, and then the mane, you can take the mane. I mean, that's a hair-pulling technique for massage to loosen up the fascia in the skull. Oh, that's a flat wither. This was another rescue. So we don't know whether that was trauma, that she flipped over backwards. I don't feel that kind of trauma to the vertebra, that there's been an excess calcification in the ligaments at all. That's a cyst on the bottom end of it. This is the mare that had the bubble in her butt. She had so many scars. But releasing that bubble where I had my finger, her pelvis totally dropped and just helped to level her and soften her back. So yeah, it's pretty traumatic. And she's a very nicely performing horse, but if you put her in a space that she's not comfortable with, she throws herself on the floor. Have you ever heard horses like that? You know, she wants to do her job, but you put her in a place she can't handle it, and she just loses it. She's gotten better and better, they've said. I just looked at her once, but, you know, horses will go until they die for us. So to go ahead and take a little extra time and learn to look at their dents and dings and follow through with investigating the red flags is huge. Another sign of I don't know if that would actually be a prophet's thumb. I've seen a horse that they knew the history was they hit one of those wires, guide wires out in the field. A lot of us have those. You have the perfect field and the horse has the injury. You have the messy field and the horses don't get hurt. So that's me putting my finger in a dent. They're pretty substantial, but you can make significant changes in these. That's another, that I would say might have been considered a prophet's thumb. And then you look down on the point of his shoulder and you see something at the top there, which is around the supraspinatus, but you can just see where the muscles just don't look nice and fluid and soft. They're shiny, it's pretty, but it doesn't really looks like a waterfall or something coming down over his fascia. That's it with him stretching his neck, so you can see how it changes. And that was treated, so his neck is more supple, but you can see right above that dent, there's still some restriction there. This is another one, had a huge one, but for the most part, that was nicely taken care of. The posture through his neck is pretty nice. I'm sure we could find a little bit more. We go up a little higher and get over top the cervical vertebra and release some stuff, but that's not so bad there. Now this is another big red flag. Look at that horse's skin.
Yeah.
It's so tight on his body. Isn't it painful?
Yeah.
And then his sweat pattern, the nature of his sweat is telling you it's a horrible thing. You don't want to see that foamy, frothy sweat. They're nervous, they're in pain, something's wrong. And he was not an easy horse to ride. Understandably, his body's so tense. Look how tense it is when he's sitting back on his hindquarters. It's sucked right in. It's awful. So these are some more pictures of the dents and dings in the shoulder. This horse is a lesson horse and a therapy horse. And so some pictures that actually a year apart, but you can see where the shape and the contour of the dents had changed. And if you actually look, you can see they've kind of come up higher on his shoulder because his posture's changed, so they migrate. You'll have something more on the left side and you release it and it's on the center of the spine. You go, oh, that injury was probably straight down on their back. And that's a picture of him on the left when we first started, and then to the right, and that light reflection on his back's not that hollow. But you can see the difference in the posture through his neck and his shoulder by releasing those dents and dings in the front. And that's another one from the side. And so we were talking about the horse's skin being their largest organ. And the big thing is to remember it's a sensory organ. It's going to tell the body what's happening on the outside, and that affects the inside. You're going to affect the myofascial system and directly affect the circulation, the lymphatic drainage. You're going to stimulate acupuncture points, the whole broad spectrum of what you can do by treating the skin. And then we're going to talk a little bit, which is a wonderful thing, is about the visceral. You have a heart attack, you get arm pain, you can get shoulder pain. That's your visceral giving you a somatic symptom, right? You have cramps, you can get low back pain. So when we take, then we have the opposite, that from the viscerosomatic to the somatovisceral reflex, so that as you take care of your horse's body, you actually help to relax the muscles, get the blood to those muscles, and guess what? You're getting blood to the organs, right? You get a somatovisceral reflex. So that as you're working on your horse outside, his tension is less, so he feels more comfortable, but you can also affect their viscera, their organs on the inside. So you're helping more than just skin deep, it's going down into the organ system that we were talking about, supporting them nutritionally with herbs and whole foods. Well, if you can get the body functioning better, then the other things that we're doing to complement are just going to go ahead and have that much greater of an effect. So the concepts to take home, right? The dents, the dings, the loss of hair, the scar tissue. We want you to make sure that you understand looking for good posture where it starts, that the cannon bones are 4 square. There's no black and white on that. That's what you want optimally. So this was about taking that sheet home. Before you go and see your horse, see if you can remember where they have white hairs, loss of hair, dents, dings, scar tissue. See what you can recall, and then go home and investigate, maybe put it down in a pencil when you actually map it out, and then as you work on them over the next week or two, see if other things don't actually come out and show that there was deeper scars and restrictions that you're actually helping to release. So when the posture, the myofascial system's nice and symmetrical, their posture can become much more symmetrical. So you're going to increase their performance, decrease their incidence of injury, and overall improve their health and well-being. I'm going to show you how to look and feel and assess the horse's myofascial system. Then we're going to go into how you're going to you can use the cross fiber technique to go ahead and on a daily basis use it as a pre-ride warm-up and evaluation and just to help to improve their posture. This is what comes with the package. It's a 10-page booklet. It's on the back of the package. It's sealed, so it kind of shows you where you need to go with your strokes, so that the muscles on the top line run from the neck, along the back, down the hock. So we're going to go across the fibers, and that's the biggest thing, is to not do that old kind of chaotic circular grooming. You want to go across the fibers, and you want to use short strokes so you can actually feel and see how the horse reacts. And we're going to first go ahead and make sure that the skin's moving, and then you can start to go deeper. Hi, well, we're down here to go ahead and assess and address Charles' myofascial and postural imbalances. This is Sarah, Charles' owner, and she's always challenged because Charles likes to be a little mouthy and a little fidgety, and I say that's in part because he's not comfortable in his skin. Now, we'd like to see our horses stand quietly, nice and four square. We want to look at their posture and hope that we can get them to be comfortable in their bodies so that they're going to stand with their cannon bones vertical to the gravity line with their feet four square. So that's where the foundation of good posture starts, and that's what we want to evaluate. It's not black, it's black and white. The posture is either good or it's not. And his posture isn't good if he's fidgeting. And when he's fidgeting, he's putting his feet in different corners. So that's where we're starting, and we want to go ahead and start and look at how his contours are relative to his posture versus his conformation. Conformation, again, is the bony length, the length of his forearm compared to his cannon bone, the length of his shoulder. So we want to go ahead and look at his posture, and he's going to be on the move, and that's okay. This is what happens a lot with the horses. So if you can get a general idea, overall he looks pretty nice. We can stand out, we see our red flags right away. He's got actually a tattoo on the side of his neck. Well, that's actually scar tissue that we're going to look at. So then why don't we go ahead and we'll see some areas through here just to make a little mental note about his skin and how his skin looks on his body, whether it looks tight or it looks loose. So why don't you turn him around so we can see the other side?
While she's turning around, can I ask a question about those with brands? A lot. Yeah.
Mm-hmm. So he's more concerned at playing with her than he is actually about his own body, being comfortable in his own skin. So if we look at him from this side, he has the tendency to look longer and prettier through his neck as he's mushing around. Mm-hmm. When we think about what we saw on the other side he just looked a little shorter and tighter through his neck. That's one thing. And again, he's a process of being on the move. Overall, he looks nice, but we see some contour changes. You can see right in through here that there's some contour. But the first thing we want to do is just go ahead and pet him. Hi. And you always want to work within your safety and their tolerance and your safety. No, you can't bite, thank you. So so hold him just a little bit shorter. So I'm going to go ahead and just touch his skin because the skin should feel nice and fluid, and it's a light touch. It's a gentle, light feeling so that the skin is the clothes. It's going to be moving. If you feel the skin on the back of your hand, that moves pretty nicely. That's the gliding feeling. Or if you think about how it feels when you push water off of a glass top table, that's the nice feeling we like to feel in their skin. So that's where we're going to start. And as I'm stroking him, you can see his skin kind of wrinkle and it's moving. And he's more mobile on this side of his neck than the other side. Then I'm going to feel across this back here. And it's not bad, but it starts to get that feeling of being a little stuck in through there. And you can relate that to what you either see on their back relative to scars or what you're feeling when you ride them. I come back through here and it just feels harder. So it's a matter of just doing it over and over again, and this all feels hard, and we can see that there's a dent right in through here, and we'll show that more specifically. So his neck looks pretty this side. He's got more mobility of his skin in this area, and then we go down and it starts to become less mobile. So we want to go ahead and, go ahead and pet your horse. You want to stroke him. You want to see how he feels. That's the way to investigate if there's any bites or scratches or any injuries. Just go ahead and approach them with a nice gentle stroke. We want to go down the hind end, and we want to feel for how is the skin moving across the gaskins. Now, I don't know if you can, I know. I'm going to put that down. You want to go ahead and see how is that moving. And as I'm feeling it, it's nice and loose, which is very good because we need to have that ability to have these muscles expand underneath the skin. Then I go down to the hocks, and I can move the skin on the inside, and I see the skin moving on the outside, which is very, very good. That's what you want to see. There's a little bit of a stickiness, but it's not bad at all. I can then go and move the skin. So we always want to make sure, because we're asking our horses to use their hocks, we want them to go through a nice range of motion. So that skin has to be loose. We want to go and feel the legs. And as I do that, it's just a nice fluid feel. The hind legs get stickier than the front legs, all the way down to the coronary band. If you have a horse that's older, has some ring bone or side bone, you loosen that skin up around the coronary band. You're going to help those joints to move better, and you can slow down the progression of the arthritis and improve that range of motion. So you want to just go ahead and feel things, and you can see where that skin moves. And that's what it's supposed to do. I'm pulling here, and you can go ahead and see where it's moving down through here, but it gets a little tight, a little sticky. And as I loosen that up, what did he do? He just had a sigh. He says, that feels kind of good. That's right over top the lateral cartilage, which needs to be nice and flexible. When it's not, we end up having some side bone. So they're going to tell you in their posture how they're feeling, and they're going to tell you in their breathing, their yawning, their licking and chewing. And he seems to be quieting down, doesn't he? And I don't think as it sees the center of attention, just that light stroke and feeling things, you start to feel the difference. So again, the scars in through here, when you feel that, that brand was pretty deep. That's a pretty deep, they don't want to do that, but that's an area of scar tissue that we want to investigate. If you can go ahead and then we have areas of lost hair here. Some lost hair here. What that was from, you might know the history, you might not know the history, but you want to investigate that. But I can move it around and palpate it, and he's not saying it bothers him. You might go home and find a similar area on your horse, and he's going to be a little uncomfortable about it. So you want to address that chronic little inflammation that might be just between the skin and the myofascial layer below. But I have had areas where the horses have had like a rope burn, so that the skin, that scar tissue actually really thins down, and you see where it becomes more supple and the hair starts to invaginate a little bit more once you come on up here, or starts to come up some. So what we're going to look at here is where he has dents in the front of his shoulder. Here, these are the red flags. This was a bang. This was a kick, this was a hematoma, it was a swelling, it was a bruise, we didn't see it. And as it resolved, it turned into scar tissue. That's significant because the muscle that's injured goes from the back of the jaw. It's the two muscles, they're strap muscles, and they go, one goes from the back of the jaw, the other one starts here, comes down the cervical spine into the shoulder and affects the shoulder. The other part goes down into the chest. So this trauma and the scar tissue itself can have a long-term effect on the mechanics all the way up to the jaw, the pole, into the shoulder, the elbow, up into the shoulder blade, into the withers. So you're restricting anywhere in this whole upper quadrant of the horse, you're going to affect compensations throughout the entire horse. So what are we going to do to go ahead and see how he's going to respond to that? I typically can use my fingers because I'm pretty strong and I'm used to it. I'm going to use my little tool here because I can use the ends like some fingers. Pull, buddy. And I'm just going to do like a little light but specific feeling of that. And it's a very gristly feeling. And you can see he's not sure if he likes it because he doesn't have somebody do that usually. I'm just going back and forth because that muscle runs down. The fibers run down like that, so I start by going across. But when you have a significant area of scar tissue, then you'll go different directions around it because you'll be looking for those restrictions. And I don't know if you just heard a little click. Did you hear a little click?
I didn't hear it.
Ah. So I'm not doing it very hard. And when I do groom horses, my own horse, I either like to groom them free in the stall or I have them ground tied because I want them to be able to reach around and tell me it feels good, tell me if it hurts. Again, but you work within their tolerance and your safety. So he's not quite sure about it, but you heard that click, didn't you? And he's been moving around a lot, and we haven't heard any clicks, which was kind of a release of a joint. But since we've worked on this muscle, we have, haven't we, Sarah?
And what are those clicks?
His joints releasing. So when we stretch and the horses roll and buck and do all sorts of things, all being well, the body should be able to release restrictions in the joints. So and actually now I'm going a bit deeper. Yeah, see he's licking and chewing. I'm actually pulling on his withers, so I'm not just using my shoulder. It's a contact I can feel, you know, you're very smart. Stepping on my foot again. But the lick, no, that's okay. That's them talking. Their posture is their body language. And he's trying to tell me something. At the same time, they'll go ahead and say, I don't like it, but then they'll lick and chew. Or they'll pass gas. That's a good thing. That's the fact that the fight or flight of his discomfort is going away, and his immune system can start to work. Because it's all about keeping the immune system balanced up nicely.
Stop.
The whole horse's, then go ahead and bring him up here again. What do you think? I know. So I don't know if you can tell, but the shape of that's changed a little bit, hasn't it? And I haven't really done a lot because we're in a difficult place, but I've made enough change that you can see a change in the contour in the skin itself.
How about the scar on his neck?
These are actually moving pretty nicely, but we might have them turn. Hi, buddy, I know.
Stop.
So this is nice. Horses are big, and they have 4 feet. So as much as we like to turn like this, it's very important not to spin your horse around because we spin around like that, and they twist on their hocks. So he's big. He has to move slow. If you need to move your horse quick, you need to make sure, or on a small area, that they're picking their hind feet up and they're moving. So I wanted to look at this because we were talking about the gravity line. But on the vertical, you see where that dent is? And you look up at his neck here. And his crest is kind of pulled down here, right? So that's the things that we want to look. This is going to affect up here and here, down into the shoulder, but you want to look on that gravity line and see where that's also affecting. So I released that some, so I'm going to see how he can tolerate that. And we didn't do the stroke so much on this side, but you can see where that's tighter there, right? So we're just going to do a nice little, oh, I know. So the muscle fibers are running along the crest, and I'm just going to do just a nice little gentle. Okay, what do you think? Says, I'm thinking, I got a better idea. So you can see I'm using a short stroke, and I'm being very specific where I'm treating these dents and dings. And he'd want me to push harder, but because of where we're at and what we're doing. So that's a good thing. Yeah, it's a very good thing. Oh, well, we're not supposed to fall down. Thank you very much. That was very nice. You can see where this has already started to look softer. So all we did was really work on here a little bit, and then we went up high on the gravity line. So that's where you can be the artist, and you can go, but I want this to be prettier. I want it to have a nicer arch. And you can go ahead and do it from a very easy, simple perspective of the gravity and where the body's going to be compensating. So there's lots of little wonderful things I'd like to do with our Charles here. What we're going to do is just have him turn so his hind end is here. His hind end's facing this way, so we're going to have him go that direction. And Suzanne picked him out as well because he's got a dent here. Now, I evaluated it before, and he didn't seem too sensitive, but who am I? I'm not in his skin. So we need to address that as well. And I'll go ahead and put my hand on it, and it's pretty firm. But we can see now, actually, he looks softer through his hind end, doesn't he? We haven't done anything here. We released his neck. And he just had a nice, pretty yawn. And we're petting. He's like, you're paying attention. Finally, somebody's found it. So I'm just going to go ahead and be really specific through here and just use, I'm just going back and forth to start with, yeah. And he's making really happy faces up here and biting the air instead of Sarah, which is very nice. Isn't that nice?
Yeah.
Yeah. And right now I'm looking, it looks pretty easy. I'm actually putting some pretty significant pressure on him, but I'm leaning. I've got my forearm on him. I've got my hand here so I can feel what's happening to his body. I'm trusting Sarah that you always want to kind of have your ear and your eye to their ears as well. But I can feel if he's going to get tight, he's uncomfortable, I can back off, I can give him a break.
Should we just look at your chart to know how the muscle fibers flow in each area?
Yeah, well, yeah, just you can look at the picture, and then you can learn the anatomy some more, the superficial anatomy, which is in the charts that I have given. So we can see where that's a lot looser and nicer. I don't know if you see any changes in the rest of his hind end, how things are looking. So now I'm actually going to come up and down it a little bit. Because of it being a scar tissue, most scar tissue, it'll heal in a kind of chaotic manner. And that's why we do the transverse friction or the cross fiber to realign those fibers so they're running at the tensile strength and length that they were supposed to before the injury. So then after you kind of go across the fibers, you can go all around. And he's very happy. Now, that he kind of just dropped his pelvis some. And good thing, if a horse has an area that it's really sensitive, you're going to back off. You don't want them to holler their back. But especially then if you find a place that they posture in a nice position, that's a great thing to go ahead and acknowledge as well. So that was profound because I didn't go in deep at first. I said, does this hurt? You would think. But he had a nice release from it. So, and with the actual grooming technique, we always want to go across the spine. Because that skin, see his skin's not really moving here, is it? So if the skin's not moving here, he can't move in his pants. So there's going to be some restrictions, and he's not going to be able to do the lateral work as easy because we've got those restrictions. If you've got tight belt around your hips, your low rise, you're not actually going to be able to move as well. So again, short strokes, because if I do a big stroke, by the time I've hit something sore on him, he could have stepped on me, he could have stepped away, he could have kicked at me, or I just missed where it was because it needed to have the attention there. So 4 to 6 inch strokes. You start light. I'm going a little bit deeper because I feel that I can. I can feel on the right side of his back, though, is wanting to be tighter. But he's raising his tail. Anytime a horse is holding their tail tight, then you know that they've got something tight in their back. So lifting the tail up and moving it around is always a very, very important thing. So now we can go like that, and you can see where his skin's starting to move better. So you sometimes do have that crease in a horse that is really big hind end. The crease is okay there as long as that skin's moving. The crease in the back when they put their head down has to come up.
You go across the muscle, you don't go
Across the fibers, yes.
opposite to the way it's
Opposite to the muscle fibers, but when you learn the anatomy a little bit better and understand there's times you're going to go with it, say with the legs. I'll go ahead and use the groomer across. So that's where I want to go first. I want to see how is that moving. You know, I use it across the hocks. It has a nice contour for me. It's got a nice contour for the horse, so it falls into the nooks and crannies. But because we've got the superficial, the deep flexor tendons, we've got the suspensory, they're running that way. So after I do that, I'll go up and down. On the crest, when I want to do some advanced stuff on the crest, it's almost like doing a roughing, where we saw on the Gaskins where those muscles had to go like this, right? So then sometimes you have to go up in between them. I might say that he's not as well defined here. So after I've gone across the Gaskin and made sure that's nice and loose, then I might go up and down because I want to see more.
You did the same thing on his lower leg.
On his lower leg, right? Because you know there's some muscles that are stuck and they're not moving this way. But first do the cross fiber on him. Well, I think that was quite the nice demo with him, don't you think? Thank you, Charles and Sarah. Naomi and Trumpet. So it's nice to have gray horses, right? We don't hold it against them that they're gray. We hold it against them that they might get melanomas. Ah, hi there. You're very handsome. No. So we want to go ahead and look at him, and it's really good to be able to bring a horse up and just stop them and then see how their posture is. But his tendency should be to want to stand square. That's not bad. We're not going to judge. He might stand square more regularly, but we're going to say I think his tendency is probably not to stand four square. He rests. How does he usually stand up front?
pretty square up front, but always resting.
Yeah, can you go ahead and make him stand up square? So it's a good thing to see how they want to stand and then try and have them stand square and see what they do. And it's a bit of a distraction, but he shows, doesn't he? There you go. Thank you. So we're going to look at him standing four square. How do his cannons look on the vertical? A little bit forward on the hind end, yes? Just a little bit. It's not a lot, but it's a little forward on the hind end. And he's standing a little bit underneath himself on the front end. So that's the black and white. It might look good when you weren't educated, but now you're educated and you understand that we want to see four square so that we don't have the stress and strain on the tendons, on the ligaments, and especially with a horse like him where he's a little borderline long in his pasterns. So that's where we have some conformational stresses. It makes for a nice, comfortable ride. But for their longevity, we especially want to make sure that we're keeping the stress and strain off of the joints, off of the soft tissues, because of some conformational stuff. So if we don't have optimum conformation, we really want to try for optimum posture so we can protect them and their longevity as long as possible. So let's look at his scars and stuff to begin with. As I pet him through here, we can see he's got a nice contour, but he looks a little tight through his neck, a little thicker through his crest, a little dippy through the front, not to take it personal, a little tight through here. And you can see where, did you ride him today? So he has the tendency to get a little roughed up underneath his saddle pad a little bit. It's just little subtle things. You feel that's a little, it's a little bit almost coarser there from what's going on when he's moving. So you want to feel that skin. It's got a little bit of a dimple in through here. And we'll be nitpicky. There's loss of hair here. When you feel that, that's like almost a millimeter deep, which is pretty significant. That he had trauma there to affect the hair. This is huge. That's hair loss here. That's right in your organs. That he had some sort of bite or kick or something. So the mechanism of injury could have been he was pinched and he lost the hair, or that he was really grabbed hard and he, tried to avoid more injury, which then could affect the stifle, the hind end, the lower back and everything. So we don't want to underestimate these. And it might not bother him now, but as his body changes, you might find that now it's opened up more or stretched. So we find more reaction because of the adhesions breaking up. The scar tissue breaking up can cause some inflammation. So you're not to be surprised about that. Little kind of V thing there, loss of hair there, loss of hair there, loss there. Nothing really horrible. He's got just a little dent here. He's got a dent in the front here. So here, it's tough to see on the gray. So why don't you turn him so he's facing us. So then if we have him lift his head up, see how he's lifting his head up? You can see where there's disruption in the skin and the muscles. Can you see that? Right? So he'll be a very good sample. What I'm going to do is see if he'll let me bring it and stretch his leg forward. Okay, so you hold that there, and we're going to do this one. So actually, why don't you stand the other side? That's great. So this is what you want to look for. And I don't have people pull the leg straight out typically because that's potentially a situation that you can get injured, but you can do this. And as I pull forward here, you can start to see where that dent comes up more. Can you see that? Yeah, the little one in the front and the restrictions in here, and see how he's bending and flexing? Can you see that? Scar tissue, it's not as profound as we. So that's a way to also look. And as he's flexing and moving, there's other signs, more subtle, in through here where there's not quite, you can start to see them pop out. Some of it is just a restriction there. So let's have you, so he's facing this way for me. Hi. So now this side, generally how does he look? He looks actually a bit tighter. Tighter through his neck. You can start to see too much definition, and it's not a soft definition. You can see where there's something going on in through here, loss of hair, loss of hair, loss of hair here and here, that he had some sort of trauma right up in his crest here, and I pet along his crest, and that's fairly fluid. Come along through here, and it starts to feel a little stickier through his back, that it's really not quite moving. It's not a six-way stretch. He's got another loss of hair here. Point of the hips is very common, coming through doorways. And he just looks generally a little tighter. The surface of his skin, he's got a little kind of disruption here, in through here. It's just not quite as loose. I do that and the skin's really just not moving. So what do you think we should do? Huh? So nothing horribly sticks out with him. That I think he's going to be a good boy, that I can go ahead and play a little bit with his shoulders here. But what we wanted to also use him for is to show you, go through a quick run through of the actual grooming technique. And he's a great candidate. But I'm going to play with these dings a little bit on his shoulders and see what he says and how his body actually might change while we're here for a moment or two. And how long have you had him for, Naomi?
Not quite 2 years.
Oh, it's a little tender, huh? Oh, a little tender. Oh, I know. Sorry. So he went to bite me and then he licks and chews. Well, maybe that is pretty good. So I'm just using my finger to kind of loosen it up. I'm actually using my fingernail a little bit. I'm not using a lot of pressure, so it's easily something that you could do, Naomi, to go ahead and feel through that contour and feel for any of these dents and dings. I think I should move my foot from standing in front of you. So that's a good one there, and he's kind of thinking about that. That's that higher one, huh? So is his neck changing a bit on that side? It's lengthening a little bit, his neck. He feels softer here in my fingers. I can feel this soften up as I'm working on him, so I figure he's got to be changing a little bit in a good direction. So now he's thinking about standing a little bit better on this right fore. So when you run into the tack room and you grab your saddle after you've groomed him, hopefully you come back and you see a horse standing four square, right? That's what we want to see, not a fidgeting one going, hello, are you there yet? So that's where I'm actually kind of getting between the muscle, where the scar tissue is. There's scar tissue between the fascia of the two muscle groups. And that's where not having them on cross ties, but freely having them be able to move around, but you can be safe by having them on the end of a lead line. So as we did that, you notice how this dent, there's a little dent starting to come out here more. That's where that happens as things relax. You see things come out even further, and this just in through here, his crest just looks that much softer. And I haven't done much. So the technique itself is broken down into 3 sections. So we want to do the top line zone first. And optimally, you do the left side, then the right side, do both sides. Then you're going to do the core zone. So once you've loosened up the top line, when you work on the core, they can stretch up and their muscles and their tissues are more relaxed. Then we're going to do the timing zone, which I call, because that's where the well-shod feet are going to act like the cams of a car to give them the good timing to support the posture above. And by that time, we're pretty warmed up ourselves. So I'm just going to check him here through his stifles. What a good boy. And he's moving pretty loose through his skin. Good for you. Very nice. A little sticky in through here. See, as I'm moving here, it's not quite moving here. And he's actually not looking so clean there. And aha, there's scar tissue here. There's a length of scar tissue. And there's some right down in through here. So sometimes it's easy to see on gray, sometimes it's not as easy. There's some stuff going on here. But you always want to start from the point of the hip forward, because the neck can hold so much compensation. You could spend 20 minutes working on the neck and still not make a lot of change. Where if we start back here, by the time you get to the neck, normally they're that much more relaxed through their whole top line. So again, within his tolerance and my safety, I'm going to go across the point of the buttock, and he's very nicely moving his tail out of the way for me to do it. I'm using short strokes. I'm feeling up here with my hand, because now you can actually, I'm going to be bad, but this way I can show you. You see how the skin across the point of his hip is starting to move and start to loosen up. So even though I'm working back here, the skin's loosening up as we go forward. And that's why you want to start on the hind end. So this is really not the posture or the position you're supposed to be in. I can actually you can start to see things move. And as I'm starting to loosen up, you can see where he's starting to wiggle and be soft in his legs and his feet. And then he's gone, yeah, I really like it. And you see the skin moving on the point of the hip. The point of the hip and the cap of the scapula, I call it functional axes of rotation, because we have so many muscles that are stemming from here, right? It's like the spokes of a wheel. So muscles have to be happily attached at the 2 points where they're starting to work from. So the origin and the insertions, those muscle fibers, tendon fibers have to be happy. So if you take care of the point of the hip and all those insertions and tendons there, as the muscles stem out, they're going to be that much healthier and happier. Same thing with the cap of the scapula. You've got muscles that are stemming up through here to the crest, down the shoulder, down the back of the arm as well. So there are 2 points that are really important, and you can just see how much looser he is. Now I'm going across the sacrum, and you do little scans, and he's a very happy and receptive person. Now there, it's getting a little tense. You can see his back's tensing up. I had my arm across it so I could feel it. He's not really getting hollow, so I'll still stay there, and I'm going to really go around the point of that hip. And now we can see where his butt is getting nice and soft. The thickness of that muscle is easily 3 inches, maybe 4 inches in some places. He's kind of sinking real nice into his fetlocks down there. So, such a happy boy, Naomi. So they get sore and tight across their back. This is an area where quite often you have to lighten up. You don't want to ignore it. You want to go ahead. It's almost like I say, like doing the little Ouija board. You're just using the weight of the groomer. That I want to loosen that skin up. And as I do that, see, he's starting to be more receptive. He's showing me signs. His body's relaxing, and he's saying that's pretty good. So I can see about going deeper, or I can say, well, that's good for now. I want to go forward, and I'm going to work on their skin and see how their skin is going and work forward from there. But you might give yourself 30 to 60 seconds in an area that's not moving. And if it's not working, he's not relaxing, then move forward, because it could be something stemming from the other axes of rotation. We do have a fly. So I am actually going a little harder. You can see where he's softening up, and he's actually posturing quite pretty. This is where the lower traps come in. You can change the contour of a horse's back. You'd be surprised when they're really steep and hollow back through here. They'll like to be groomed here because that's going to help to loosen them up so that they can lift their back up against the supple and softer muscles. So I'm going to go across the withers. And you can see now, hopefully, can you see? As I'm going across his withers, see the skin on his belly? Down by his girth, it's moving. It should be doing this. So we're nice and loose. That's what it needs to be. So the rib cage can open up and move. He can go ahead and contract through his barrel and move and use all the joints in the way that they were supposed to move. And it's just, it's a lovely thing. It's a lot of fun. You can see how much looser everything's becoming as we go forward, and we get little nubbly things, kind of hive-like, but that's when the blood flow is coming to the skin. We're helping the lymphatics. We're stimulating acupressure points. So the crest is a very thick ligament, and it takes a bit of time to work through, but if the neck and especially the crest is tight, you're going to have a crooked horse when it's tight one side versus the other. Ooh, I know. So then I'm going to start to come down a little bit lower and go more so into the base of the neck, and that muscle, that brachiocephalicus, where he's got a dent into, it comes down like this. So we're loosening that all up. The horse's spine is down here. It's not up here. This is soft tissue. That's why they can elongate their neck. Their joints in their neck are like a ball and socket. So they can shorten it and they can lengthen it. But this is where the spine is. Oh, that's nice, huh? That's a good stretch. So that we want to have nice definition of the shoulder. The muscles that actually lift their withers is the thoracic serratus. There's a cervical serratus. And when that gets tight from posture, it'll pull their neck down. So it kind of fans like this. So what you want to do, we want to have a nicer definition of the shoulder. So I'm going to come in the front And I'm going to try and go into that nice soft area and then come deeper. It's kind of like when you get a massage and the masseuse has you put your hand behind your back so you can loosen that up. So the whole time I'm using my core here, I'm warming my core up, I'm thinking about my posture and where I'm standing, what I'm doing. So the shoulder muscles run this direction. There's times when the shoulder just looks flat. So after you go across the shoulder, then you might want to come up and try and separate the muscles out in between. So the direction that the hair generally grows is generally the direction of the muscle fibers. So you go across that. If you see a silhouette, then you're going to go across that, or a profile. I'm looking at his shoulder and his chest here, so I'm going to go across it that way. And right now, I'm stabilizing and using his wither so I can actually not overuse my shoulder. Yeah. And so he looks pretty good there, but you can see where there's an outline here. The infraspinatus, you got the triceps back here, so I might decide to come up and through here because he kind of looks flat here. And that's a highly, if you remember the fascial picture, there's a lot of fascia there and it might feel like bone, but that's all got to move and glide freely. Horses that are jumping, there's a little attachment back here. And the muscle from the lower trapezius, the triceps, and the latissimus come in there. So when they're jumping, sometimes even if the saddle fits well, it shifts forward. So your jumping horses can get sore there. So that's where I'll come up to the back. And you can just see, now when I'm doing that, you can see the skin down in the back of his elbows starting to move. So he can go like that for you. He can reach. Doesn't have those restrictions. You want to go within the, for the core zone, I'm getting more into it, you want to go into the angle, stay parallel to the ribs because there's muscles in between all the ribs. And they need to be able to expand and contract so that they can breathe. The rib comes up and inserts and attaches to the spine. If the rib cage is tight or stiff, the spine's going to be tight and stiff. If I can't like ask him to move, ooh, and bend, yield through his rib cage, right? He don't like it.
He hates on the left side, so really
The left leg.
that is really
So you want to try and release it here so that when you're under saddle, it's not such an issue. So that's where when you're looking, you're thinking, you're spending some time, you can relate it and start to warm them up and get them ready for what your lesson's going to be or your training's going to be for that day. Yeah. Whoa. So his posture is talking to me, isn't he? In a very polite way. He's not trying to step. He's standing still because he's like, you're really not going to move away from this. There's some good aspects of this day, right? This is where we're coming into the lower part of the rib cage that every horse can be ticklish sensitive here. So can we. So could be visceral, could be ulcer, could be colon, could be just has to go to the bathroom and he likes to go in a stall. You know, it could be anything. So we always want to be careful, and you know, the more you know your horse, the more you know you can do for him and about him. So, oh. But it's always, I'm doing shorter. Sometimes I'll go big here because the muscle groups aren't that big. You're not going to run into a, you know, a big adhesion or really sore muscle. So down through here is where the abdominal muscles insert into. And as I get lower down and through here, which is where his rectuses are coming in, we're asking him to collect, we're asking him to bend. He's a little sensitive. So when they're sensitive like that, lots of times I'll just take the groomer, put it on my hip like this, and just put it there, and then I just kind of move it around. Gently move it around. I know. And I can feel on the other end of the groomer where his skin on his belly feels kind of gristly. And that's when you pet him there, you'll be able to feel that. And you want to loosen that up, I know. Good boy. He's thinking, well, it's not as bad as I thought it might be. So I'm going to go forward and go more to his girth and his chest. And for the chest itself, I come into the sternum. I want you to hold him a little shorter. Because the chest muscles come in this way. So if you just come up and down the sternum and then into the arm, you'll be able to get a lot of that pectoralis. And he's a little sore in insertions of his pectoralis here. So he might not want to reach like this. That's part of the sling mechanism that's going to help them shock absorb. So that's not happy there. Whether he's guarding because he's not using his abs well, whether it's because of the scars and the dents in his shoulders. Oh, so now you're thinking it's feeling a little better. So it's really not taking. He's a great, great guy. Yeah, he really is. So this does feel tighter here, you know, so you want to just go and realize that's a little tighter through there, even though we see it moving when you get your hands on it, and I've got my hand up on his back, I can feel what's going on. But now I'm actually coming in this area that he didn't like so much. He's lifting his back up underneath my hand now. So then we'll do just a little here, and we'll see what are you going to have to say. Is, well, maybe. You can use your hand to go and feel and see if you can find out what's going on. That's why I had taken and I had, you know, kind of felt his belly a little bit to see if we feel anything. Again, we do want to use our intuition. We want to think about how we know about a horse, what might have happened. And most definitely, again, the technique is the cross fiber. When I'm done riding, if I'm going to give my horse a bath, I'll take a brush and I do a cross fiber across the sweaty back. Because it shouldn't hurt him. I need to check that out versus just going, I'm going to give you a bath. Because if something's not right there, you want to know it before you're going to rinse him off or give him a bath and put him up. So I'll use that, or if I'm not going to even give him a bath, it's just the sweaty mark, I might take a towel, good old-fashioned towel, and rub them down with a towel and see how they respond or they react. But even he's standing up differently, right? I'm thinking this is different. So I'm going to come back now. The hamstrings on all of us, humans, horses, are usually tight. So that's why you start here, go forward, loosen them up. And then you can come down to this area and say, well, how does this feel? You come right to the hamstring, and they're going to say, I'm not sure about that. So I don't start there by any means. And he's a little sensitive. He's quite sensitive. So I'm just going to use it with the weight. I've got my hand here so I can just feel if he's going to pick his leg up, if he's getting tense, I want to back off. Ask him to keep his foot down, and you can see his little ears are going, oh, well, maybe. His tail's going, maybe. Maybe I'm going to trust her. So today might not be a day that I'd go to the inside of his leg so much. You know, you want to have goals about what you want to achieve, but if you can take, 45 minutes for a few days out of a week and really go over your horse, after a while, it really doesn't take as long because you've helped the horse so much that everything stays looser. All being well with their shoeing, their foot balance, their foot protection, their foot health, saddle fit, yeah. So it's the whole health care of the horse, but yeah, it should just cumulatively get better and better. That's what we're striving for. So now I went to his quadricep more so, at his stifle. Now I'm coming back to his hamstring more. So you need to investigate and see what is the actual formula for that horse. So I'll go up and down, and depending on the horse, you can go right across the stifle. If you can't do that kind of stuff, it is a red flag. We need to get the balance right. So what do I do if my horse has been in good shape? I know my horse through my cross fiber grooming, his posture looks good. I don't have a lot of time to ride, but I really want to ride. So I take the groomer and I go, okay, how you feeling today? And I'll do a scan like this, to make sure I'm not going to find anything. Brush them off, have a look at them quick, throw my tack on and ride. Once you can see, it's not to get them clean. My horses are some of the best groomed horses. They're not clean. Well, they will be now. I've got my vacuum back in the barn. So, but you start to stir up a lot of dirt when you're doing that. But no, that was fabulous. Very, very good. Hi. And he just looks softer. His neck looks better, looks softer. You saw his body changing. So wonderful thing to use at any point in time. In the middle of the winter and you don't want to ride, just come and put your hands on your horse, groom him, get warmed up, see how he's feeling under those blankets. You can assess how they're doing. It's profound.
Yeah, I actually can see this as an enormous tool for during layout.
These little bumps are the little skin bumps? Or
Well, it's from where I put pressure here, and then it starts to drag. So it's an area that the skin actually started to loosen up even deeper first. They go away, yeah. Yeah, when you don't want to first start this at a horse show at your initial grooming before you're riding, because they might get some of these little dimples. But they go away, and if your horse has skin sensitivity, they're sensitive to bugs, chances are their skin's tight. So their lymphatics aren't draining well, but over time, the lymphatics start to work better. They're not as irritable. They're not as reactive to those bites and dings. So not to be surprised with those. They're the ones that quite often have a little bit more of those dimples to start with, little dots, dimples.
And some of the dimples and dings disappear.
They do. They soften up quite a bit. Other ones can come out.
Right.
Other ones can come out, and then you want to just address those. But yes, they will. But the hair loss does not typically go away. But you notice that looks bigger. It's more noticeable. Where he had loss of hair, it kind of sticks out more. See the size of this one? So his skin's relaxed. So instead of it being hidden, it actually looks bigger. Yeah. Very good. Well, thank you very much. That was wonderful. Wonderful. Very nice.